All right, let's jump right in. Today, we're talking about a drug that is a true workhorse in emergency medicine, magnesium sulfate. You know, you'll find this stuff in pretty much every crash cart and ambulance out there, and for a very good reason. It's an absolute powerhouse. So, let's find out why.
So, let me start with a question for you. What if I told you that there's a single drug that can handle all three of these massive life-threatening emergencies? I mean, it sounds a little too good to be true, right? But that is exactly the role magnesium sulfate plays. It's kind of like the ultimate multi-tool when everything hits the fan.
So, here's how we're going to break it all down. First, we'll get to know the drug itself. Then we'll look at its life-saving uses, cover the red flags you got to watch out for, go through the user's manual for dosing, and wrap things up with some critical safety checks.
Okay, first up, let's get right down to the basics. What exactly is magnesium sulfate, and what's the magic behind how it does what it does? So at its core, magnesium sulfate is an electrolyte. Its main gig is to act as a sort of natural calcium channel blocker. The best way to picture it is like a dimmer switch for the nervous system. It just turns down the volume on the signals that are zipping between the nerves and the muscles. And that one simple action is what makes it so powerful for stopping seizures and calming down a crazy, erratic heart.
Now this is super important. The way you give this drug completely changes how it behaves. If you give it through an IV, boom, it works instantly, but it's gone in about 30 minutes. Give it as an IM shot, in the muscle, and it's going to take a whole hour to kick in, but it'll stick around for 3 to 4 hours. So the big takeaway here is how you give it is everything.
All right, let's get into its toolkit of uses. I mean, this is where magnesium sulfate really shines. It has an incredible range of applications for totally different emergencies.
Man, just look at how versatile this is. In OB, it's used to stop eclampsia, which are these incredibly dangerous seizures during pregnancy. Over in cardiology, it's the go-to for torsades de pointes. That's a really chaotic, twisting heart rhythm that can kill you. And then for breathing emergencies, it can actually open up the airways during a severe asthma attack when nothing else is working. It's a true multi-specialty lifesaver.
Okay, with a drug this powerful, you have to be super aware of the risks. So let's shift gears and talk about the red flags, when you should absolutely not use it, and what side effects you need to be on the lookout for.
This breaks it down perfectly. Over on the left, you've got the absolute do not use situations. If a patient has a heart block, major heart damage, or their magnesium levels are already sky high, you just don't give it, period. On the right, these are the things to watch for while you're giving it, like their blood pressure dropping, a slow heart rate, or the big one, their breathing slowing down.
And this right here is a massive warning. If your patient is taking certain heart meds like digoxin, which helps control how strongly the heart contracts, you've got to be extremely careful. The two drugs together can cause really serious, totally unpredictable heart problems. This is a huge safety point to burn into your brain.
Okay, so we know what it is, when to use it, and when not to. Now for the really practical part. How much do you actually give? Let's open up the user's manual.
This table is basically your cheat sheet. And notice how the dose and the speed you push it changes depending on what's going on. For eclampsia, it's a big dose, but you give it slowly, over 15 to 20 minutes to gently calm the nervous system. But for a cardiac arrest, it's a smaller dose, and you're pushing it way faster because you need to stabilize that heart like now. And for kids, of course, it's always based on their weight to be safe. Tailoring the dose like this is just crucial.
We've made it to our last and honestly, probably our most important section, the safety checks. This is all about how you protect the patient while you're giving this powerful drug and right after. The key thing here is just being vigilant. First, your kidneys get rid of magnesium, so if a patient has kidney failure, you have to be so careful because the drug can build up to toxic levels really easily. You also want to try to avoid giving it within 2 hours of a baby being delivered. And after you give it to anybody, you are glued to that patient's monitors. You're watching every single vital sign.
So what are you watching for? Well, a drop in blood pressure can be an early hint. But the classic textbook sign of toxicity is when they lose their deep tendon reflexes. Like when a doctor taps your knee and it doesn't jerk anymore. If that reflex is gone, that is a huge red flag that you are heading into the danger zone. Next up could be slowed breathing and even cardiac arrest.
And if you see those signs, here is your 3-step emergency plan. Step 1, and this is pretty obvious, stop the infusion. Just stop it immediately. Step 2, you give the antidote, which is calcium. Calcium basically goes in and directly fights the effects of magnesium at the cellular level. And step 3, if their breathing is failing, you have to be ready to breathe for them.
So, to wrap this all up, this quote really says it all, doesn't it? Magnesium sulfate is an amazing, incredibly useful tool in our medical toolkit. It saves lives in so many different dramatic ways, but all of that power comes with a really profound responsibility to use it smartly, cautiously, and to always be watching. From stopping a seizure to saving a heart, we've seen just how vital this single drug can be. So the final question isn't just about memorizing some facts, it's about being able to apply them. Understanding both its power and its risks, that's the real key to using this tool with both competence and caution. Thanks for tuning in.